Hello, my name is Cynthia. I'll be your nurse today. What is your first and last name?
Ivy Mosley,
What is your date of birth?
born 18-2000,
And what is your age?
21 years old.
Okay, up here stated age. Okay, today I'm here to do a physical exam. You might hear me call it a health assessment, but I'm going to be checking over your whole body, okay? There will be some touching involved. Is that okay?
Yes.
At any point, if you feel any pain or discomfort, will you let me know?
Yes.
Okay, I got a few questions to ask you. Do you know what year it is?
2016.
Okay, do you know where you are right now?
Randolph Clinic.
And what brings you into the clinic today?
Health assessment.
Okay. And who's the president of the United States?
Barack Obama.
And do you know what time of the day it is? About what time it is?
12 o'clock.
Very good. Okay. How's your eating habits? What did you have to eat yesterday? What do you have for breakfast?
Oatmeal and an apple.
Okay. What about lunch?
Taco salad.
And what about dinner?
Steak, carrots, and bread.
And what you have to drink?
8 cups of water.
Sounds delicious. You didn't bring any of that with you today, did you?
No.
Okay. All right. All right. Awake, alert, and oriented to time, place, and situation. Okay. Thought process is organized, and concise. Mood is pleasant and congruent. Cooperative to answering questions. Based upon nutritional questions and assessment of body, nutritional status appears adequate. Hygiene appears clean and appropriate. Miss Mosley, can you stand for me? Do you need a walker or a wheelchair or anything to stand?
No.
Okay, can you stand up for me? Any pain when you stand up?
No.
Okay. Posture and position. Posture is erect, position is relaxed. Very good. Dressed appropriately, not disheveled and clean. All right, what I want you to do, I'm going to watch you walk. Walk from that table over there and back for me, okay? Emulated with a steady gait with balance. No disformities noted. Any pain when you walk?
No.
Very good. Okay, next thing I'm going to do, I'm going to look at your skin. Can you hold out your arms for me and I will be touching? Do you have any bruising or open spots anywhere on your body?
No.
Okay. Skin is warm and dry to touch. Now look at your nails. Nails are clean, dry, intact, oval. I'm going to do this right here. Watch this. To turn white and come back. That's called a capillary refill. And it was less than 3 seconds, meaning your blood is flowing beautifully inside your body. Then we're going to look at your pulses. You have a radial and a brachial. First, we're going to check the radial, checking how many beats per minute your heart does. Pulse is full, not non-thready. That's the radial. Brachial. Pulse is full, not thready. Very good. Next, I'm going to look at your hair and your scalp and your head. That'll be touching, okay? Have you noticed any bald patches in your hair?
No.
Okay. Hair is black, coarse, evenly distributed. No patchiness noted. Look at your scalp. Have you noticed any sores in your scalp?
No.
Okay, very good. No sores or open lesions noted in scalp. And I'm going to feel your head. Does that hurt when I feel it?
No.
Okay. No lumps or masses noted on cranium. Very good. Next thing we're going to do, we're going to look at your face. Can you give me a big smile? Very good. Go ahead and open and close your mouth. Good. That's cranial nerve number 7. That is your facial nerve. We have 12 cranial nerves spread out through our body. We're going to be going over those as we do the exam, okay? And while we're here, we're going to go ahead and check cranial nerve number 5, which is your trigeminal. So, when you open and close, you feel like a little joint, a little bump. Do you feel it sometimes? Just on your face when you're playing around. Go ahead and open and close for me. Feel that? Do it again for me. One more time. That is your TMJ, your temporal mandible. Temporal mandible is where your two bones join together. And you opened with smoothness. There was no clicking. Did you have any pain?
No.
Okay, no pain or clicking, so that was a good thing. So that is intact. That is cranial nerve number 5, trigeminal. While we're also here, let's go ahead and look at your temporal artery, and we're going to look at your sinuses, okay? So right here, on the sides is your temporal artery. You have a pulse bounding right there like you did in your hands. And I feel it, and it's even and symmetric and full pulse on both sides, not thready. Now go ahead and check your sinuses. Sometimes we get a sinus infection, we get pressure in our face, and that's in our sinuses. So I'm going to feel. Any pain?
No.
That's the frontal sinus. Any pain down here?
No.
That's your maxillary sinus. So both of those are good. Good thing. Okay, next we're going to look at your neck and lymph nodes. So first let's look at your neck. Any pain when I touch?
No.
Palpate. Okay. Neck is symmetry, midline to the body. No lumps or masses noted when I palpate. Very good. And while we're here, let's go ahead and check your trachea. Trachea is running right down the middle of our neck. And you see this little notch I have? I'm going to put my finger on yours. And what I'm doing, I'm going to slip it off to both sides just to see if your trachea is midline, okay? Let me know if you feel any pain. Any pain?
No.
Okay, trachea is midline and center, which is good. Okay, let's go ahead and look at your lymph nodes. You have those spread out through your body. Sometimes when you get sick, our lymph nodes get infected and they're sore to touch, or they might be swollen up, bulging. So I'm going to check those that's in your head and neck, okay? Face and neck. First thing is your preocular. Any pain when I palpate?
No.
Okay, then we'll come behind the ear. Postocular. Symmetry noted on both sides of those lymph nodes. Go to the base of your head, occipital. Any pain?
No.
Okay, then we're going to come here. This is your judomasculoid. Any pain?
No.
Okay, we're going to come down, submandibular. Any pain?
No.
Then under your chin, your submental. And then from there, we're going to go to your anterior neck. Just lightly, just putting a little bit of pressure on them. None of them feel distended, which is good. Then I'm going to come to that was your anterior cervical. Now I'm going to go to your posterior cervical. Okay, very good. Then I'm going to come right here above this little bone we have sticking up right here. That is our that's our clavicle bone, but we have a lymph node there that's our subclavicle. Any pain when I press on it?
No.
Okay. So all lymph nodes are present. Symmetry on both sides of the body with them. None are sore to touch and not distended, so which is very good. Also, while we're here, let's check another cranial nerve. Cranial nerve number 11, your spinal accessory. So what I want you to do, turn your head side to side, touching your shoulder like this. Okay? Go ahead and roll your shoulders for me. Roll them to the back and roll them to the front. Very good. Good. That cranial nerve's intact. That's cranial nerve number 11. Very good. Okay, from there, we've checked all of that. Let's look at your eyes, ears, and nose, okay? I see you wear glasses. Do you wear them all the time or just to read?
All the time.
Okay. Can you take them off for me just for a second and I'll let you put them back on? Okay. I'm going to be touching, okay? Looking at your eyelids and your eyebrows. Clean, dry, and intact. No redness or open sores noted. Eyelids slightly overhang the eyeball the way they should be. Eyes have symmetry in the face, which is good. Okay, I'm going to pull down on the bottom of your eyes, okay? And I washed my hands before we started the assessment, okay? Conjunctiva is pink and moist. Sclera is china white. Very good. Iris is flat, round, with even color distribution and regular. And cornea is clear and smooth with clarity. No cloudiness noted. Okay? Now we're gonna do another little game. I'm gonna want your eyes to move. We have three cranial nerves to check. 3, 4, and 5, which are your oculomotor eye movement, trilichter, and your abducent. So what we're gonna do, I'm gonna make an H with my light. I want you to follow it, but keep your head still and move your eyes as far as you can following the light, okay? So we're gonna start here. Very good. Those cranial nerves are present. Very good. You can go ahead and put your glasses back on. And I'm going to look at your ears. Okay. Any discharge or any bleeding from the ears? Have you noticed? Okay. Ears are clean, intact. I'm going to press all around the ears and on the ears. Any soreness noted?
No.
Very good. Okay, we're going to do another little thing called the whisper game. I want you to hold one ear like this while I whisper in the other one, okay? And repeat what I say. It's just random words, okay? Yell them out.
Baloney. Monkey. Toast.
Very good. Let's do the same thing on the other one.
Mexico. Teddy. Baby doll.
Very good. Pass the whisper test. Very good. Now let's look at your nose. Any problems with smelling or anything like that?
No.
Okay. First thing I want you to do is close your eyes and I'm going to wave something under your nose. Now you tell me what you smell, okay? What do you smell?
Alcohol.
Okay, you can open. It was an alcohol wipe. So olfactory is your cranial nerve number 1. It is intact. You have a nose, so that's a good thing. Your nose is intact with no lesions or soreness or discharge noted. And I'm going to take my finger and put it on each nostril, okay? And I want you to breathe in and breathe out. Go ahead and breathe for me. Very good. Okay. Any pain when you did that? Any trouble breathing?
No.
Okay. Patency is present on each nostril. Very good. And I'm going to look inside. Mucosa is red and moist with no discharge noted. Septum is present and not deviated. Very good. All right. This concludes the first part of our assessment, okay? This is Mrs. Mosley, a 21-year-old female in the hospital for upper respiratory infection. Upon assessment, no abnormalities noted. Speech is clear, articulate to native language. No non-pressurized speech. Volume and tone is normal. She's awake, alert, and oriented to time, place, self, and situation. Thought process is organized and concise. Nutritional status appears adequate based on body assessment and nutritional questions. Scalp, skin intact. Skin warm to touch. All lip notes are present with symmetry. No pain to touch. No swelling or inflammation noted. Ambulates with a steady gait. No disformities noted. No assistive devices needed. This concludes part 1 of our health assessment. All cranial nerves also present on this part of the assessment.